Hello, good day and welcome to my channel. My name is Dr. Emmanuel Odoma Alpha. I'm an advanced psychiatry registrar here in Queensland. And today I just thought to do a video of what the psychiatry residency training in Australia looks like. If this is your first time coming to my channel, please subscribe, give a thumbs up, and share the video. In my previous videos, I already talked about how to immigrate to Australia as a doctor. So check the link below, you'll find those videos. So today I just want to break it down into the structure of psychiatric residency training in Australia and also the assessment that you need to do in the residency training. So to start with, the structure of the residency training in Australia is pretty straightforward. The training is for 5 years, minimum of 5 years. It can take a bit longer, depends on how quickly you're able to complete all the assessments. The first year of the training is referred to as stage 1. Okay, the second and third year of training are referred to as stage 2, and the fourth and fifth year of training are referred to as year 3, or rather stage 3. And the stage 3 is also referred to as the advanced stages of training. Now, in the first year of training, you are required to do an acute care, an acute setting. You do a rotation in an acute setting, for example, the acute inpatient unit or with the acute care team. So 6-month rotation in an acute setting and 6-month rotation in non or subacute setting. It could be in a community setting. That's the first year. Now the second year of training and the third year of training, which are referred to collectively as stage 2 of training. Within that 2 years of training, you're required to do some mandatory rotations, which include child and adolescent psychiatry rotation for 6 months, and consultation liaison psychiatry for 6 months. And then you can do elective rotations for the other 2 rotations. So just to summarize that, each year you have 6-month terms, right? So in your second year, you need to do 6 months of child and adolescent psychiatry rotation and 6 months of consultation liaison psychiatry rotation. And then you can do 2 other elective rotations to make up for stage 2, which is year 2 and year 3. Now, year 4 and year 5, which are both collectively referred to as stage 3, you can begin to do your advanced training in certain subspecialties in psychiatry. For example, old age psychiatry, child and youth psychiatry, forensic psychiatry, addiction psychiatry. You can choose to start that from year 4 and year 5 of your training, and then you would become committed to those particular specialties. So that's the structure of the training. Now, the training is divided into 6-month blocks. So every 6 months you go to a different rotation every 6 months, and then within each 6 months you will do a mid-term assessment and an end-of-term assessment where your consultants will sit with you and assess you based on various domains, and this will go into your training record. As well, for each 6-month term, you're required to do what they call EPA, Entrusted Professional Activity. For example, it could be in proficiency in the use of antipsychotic medication. So for you to be entrusted with proficiency in the use of antipsychotic medication, you have to do 3 workplace-based assessments. So for example, you might have a case-based discussion with your consultant on antipsychotic use, and then you may have a mini clinical activity. For example, you take a history about antipsychotic use from a patient and your consultant observes you. And you can also do a professional presentation, for example, presenting a journal club on antipsychotic use. So when you've done those 3 workplace-based assessments and your consultant is satisfied, that they can give you the entrusted professional activity in the use of antipsychotic medication. So for every 6 months term, you have to do 2 entrusted professional activities. Okay? As well, for every 6 months term, you have to do an observed clinical activity, which we call OCA. Now, in this OCA, you take a full psychiatric history as well as do a formulation. You do the history taking, and your consultant would observe you. That takes about 45 minutes. And then you have a second session where you present your salient features, your formulation, and your management plan. So this is very important. So every 6 months you do that. So in summary, that's the structure of the psychiatric residency training. Now, there are assessments that you need to do in order to complete your training. And I'm going to talk about them. The first assessment is the multiple choice question exam, in short, MCQ. So the MCQ tests your breadth of clinical knowledge in psychiatry. The multiple choice question exam has 2 parts, and both of them, you take them on the same day of the exam. One part of the exam is the extended matching question, where you have a question stem and several options of answers, which you choose one. The other part of the exam is a critical analysis problem, CAP, where it's more of statistics. So both of them make up the multiple choice question exam. Now the other assessments include the modified essay question exam. So the modified essay question exam is a 2.5-hour exam, and you have 5 questions. Each of those questions will have sub-questions, and the questions are essentially clinical vignettes, and you'll be tested on your ability to apply critical thinking in clinical situations. So you can have it, for example, a case of somebody, a patient presenting with features of depression, and they might ask you question 1.1, how would you manage this patient, or how would you assess this patient? So you got to talk about the assessment in a very stepwise direction and make sure you justify your answers. So you have 5 questions, and that would run for 2.5 hours. The next exam, or the other exam, is called the critical essay question exam, which in short is called CEQ. Now for the CEQ, the college will give you a quote, and that quote can be from anywhere, and you'll be asked to discuss this quote from different perspectives, and they want to see your breadth of understanding of psychiatry and how you can apply the different domains in your argument. The other assessment is the objective structured clinical exam, which is, as the name implies. However, this is currently undergoing some modifications, and the college is modifying this into different forms, but essentially objective structured clinical exam. Another assessment that you need to do is a scholarly project, where the college expects you to do a scholarly article that is to the standard of something you can publish, and then the college assesses you if you've done that well, and then you can get passed. The 5th assessment, another assessment, that will be the 6th assessment, is psychotherapy long case, whereby you take a patient weekly for 40 sessions for psychodynamic psychotherapy, and at the end of the day you write it up and submit to the college. So in summary, the assessments are the multiple choice question exam, MCQ, the modified essay question exam, MEQ, the critical essay question exam, CEQ, the objective structured clinical exam, OSCE, scholarly project, and psychotherapy written case. Now, after you've completed all these assessments, you also need to have been in the training for a minimum of 5 years. Once you've completed all this, then you can apply to the college to become a member, or rather to be a fellow of the Royal Australian and New Zealand College of Psychiatrists. In addition to all these, there are a few other things here and there you need to do. You need to attend lectures, which we call the formal education course, For trainees like myself in Queensland, we have a formal education course which we attend once a week for 4 hours. In some other states like Victoria, you are required to do a master's degree to meet that requirement for the formal education course. So there are a few other nitty-gritties here and there, but in summary, this is psychiatric residency training in Australia. Personally, I'm an advanced trainee and I've sat all these exams that I've mentioned. I started my training from Harvey Bay Hospital, and I've worked in some of the I've worked in the biggest hospitals in Queensland. So from Harvey Bay Hospital, I worked at the Park, which is a forensic psychiatric center, the biggest forensic psychiatric center in Queensland. Then I also proceeded to work at the Royal Brisbane and Women's Hospital, which is the largest tertiary hospital in Queensland. And currently I work with the Darling Downs Hospital and Health Service as an advanced trainee. So that's the summary of psychiatric residency training in Australia. If you have questions, you can put it in the comments and I'll be able to answer them. And if there is any particular video or anything you'd like me to talk about, you can also put it in the comment section. And don't forget, subscribe to my channel, give me a thumbs up, and share the video with your friends. All right, thank you so much. And until next time, take care of yourself. Bye for now.